It is the biggest fraud, the largest lie that's ever been told, that this blue dot literally is a democratic, liberal, progressive city.
Austin has a reputation as a very liberal city, but we have no problem taking $250 million from poor people's health care.
15 years ago, you created a taxing entity called Central Health, but suddenly 15 years later, you look up and go, we don't have any health care facilities in our neighborhoods.
You've been stealing from us. This is our money that hasn't been coming to us, and we deserve to know where it's going and why it's not coming to us.
Who gets shafted in that? Two people, the poor and the taxpayers.
We need to stop begging for what we've paid for and get what we paid for so we can take care of the people who need it the most. The liberal conversation here is always, we're going to take care of you.
We don't want to believe that the politicians that we support and see on TV that are saying the things that we want to hear, we don't want to believe that they could be wrong or that they would do something wrong.
Someone has got their hand in a cookie jar.
Counties had responsibility to ensure the poor were taken care of. It started to get very, very expensive for the counties in mid-century, in the 1950s, after the Second World War. We had urbanized, we had become industrialized. The counties couldn't afford to pay for poor people's health care. So in 1955, the legislature created a constitutional amendment that says each county's voters can create a hospital district to care for the poor. Austin was one of the last major cities in Texas with a municipal public hospital paid for by the city. And that meant the citizens of the city were paying for the trauma hospital and the poor hospital for the entire county. So in 2004, Gonzalo Barrientos, our state senator at the time, sponsored a bill to authorize a county-wide hospital district so we would have a broader taxing base to provide health care services to the poor in Travis County.
I said, we need a health district in our county so that we can begin treating as many of the people in low income who cannot afford to go in and be treated.
In 2012, there was a ballot measure to increase the tax rate of Central Health, the Travis County Hospital District. One of the provisions said to support a medical school consistent with Central Health's mission.
This is a unique opportunity to build a medical school at a major research university from scratch.
It's going to be an incredible opportunity for Dell Medical School to leverage those parts of the campus that will allow us to develop new ideas, new strategies.
We're building a really interesting team. They're coming from an engineering and artistic background or industry. Having people that are coming from entirely different perspectives makes it more likely that we'll find creative solutions.
You have a powerful research institution, and most of your great research institutions are going to want a medical school.
The best universities in the country have medical schools. UT is one of only a few top 20 ranked public universities without one.
When you have a major research institution and it's prominent and you have different departments that can be leveraged into this, then you can really get research done, and you empower the university when you do that. It's always been something that was thought about for the university.
The idea for the medical school had been around for some time.
I think that the healthcare changes we will see will be phenomenal. And they won't be healthcare changes just located in a building that has the word medical school on the side of it.
When the UT Medical School was being formulated, there was a serious effort by state legislators, including Senator Watson, to bring about state funding for that. The state at the time didn't see the medical school in Austin as a priority. After several attempts, it became recognized that the state was not going to be funding the medical school.
The money wasn't going to come from the state. There was no way politically to finance this medical school.
So that led to Senator Watson looking at local sources of funding, and that's when Central Health was identified as a potential funder for the medical school.
Central Health is the public agency that ensures Travis County residents with low income have access to the best possible health care.
Central Health is a public agency that works with partners like...
In or about 2011, as a state senator, he introduced the idea that Central Health could be a funder and provider of services to a program that he called 10 by 10, 10 goals in 10 years.
I called upon this community to set a vision and a commitment for what I refer to as 10 goals in 10 years.
And those goals included a new medical school, a new teaching hospital, expansion of the clinic system, development of an incubator for innovative healthcare.
It was a way to market the idea of a medical school to the community. He had meetings and enlisted other prominent people in the community connected with the university.
We as a community set out on a mission to complete 10 goals in 10 years.
And that was the platform that they campaigned to get this thing done.
We need a medical school in Austin, Texas.
In 2011, I was invited by Senator Watson, along with other Central Health board members, to discuss an initiative that he had developed. And so he met with board members 3 at a time at the Four Seasons to tell us about this initiative. And this ended up being the 10 by 10 initiative. I asked a lot of detailed questions because it seemed to me that the medical school at that point was being positioned as a way to bring in more community primary care doctors.
Because most doctors practice close to where they graduate, we're addressing the need for more physicians in underserved communities.
I knew that the approach that was being taken wasn't like the Texas A&M model where they trained primary care doctors. This was going to be a research and development approach.
What is the cutting-edge research that's happening across campus, and how can we expose that research to the industry that exists already so that they can then accelerate its movement out into becoming a real health product?
They want to leverage money in so that they can get money from the federal government to put together complicated research that's sophisticated, that can draw donors into your philanthropic outreach, and that can be commercialized. You can do deep research, and then you can sell it.
We hope there's a whole innovation district around us, whether those are biotech or digital health, entrepreneurs.
Leveraging the full strengths of academia with the full strengths of industry so that we have people that think very differently, coming together in new kinds of teams in ways that we haven't seen before.
At our meeting at the Four Seasons, we heard the outline of the 10 by 10 approach. A lot of good things in that approach, but what bothered me was that we were going to use public monies that wasn't going directly to indigent healthcare. When I raised my concern to Senator Watson, he reached over, grabbed my knee, squeezed it, and said, "It's about economic development, son."
The UT Medical School would have a huge economic impact. It would bring an estimated 15,000 jobs to Central Texas and generate $2 billion in economic activity every year.
From that point on, it was a train coming down the track. So Austin has a legacy of developing as an innovation hub, particularly around the use of technology. The idea was that we needed innovation in all forms, and one of those was in the area of medicine and healthcare and developments of new processes and procedures and products. So the environment and the climate was inviting to bring about a medical school fostered around those principles.
This is a high-tech community. Intellectual property is of great value. You had powerful interests in the Chamber of Commerce that were heavily involved in this thing.
If UT added a medical school, it could better take experimental healthcare solutions from the lab to the bedside faster. So what's it going to take to make a UT medical school happen? 1, funding for the med school. 2, funding for a teaching hospital. And 3, public support. Proposition 1 would raise those funds to support clinics, add educational opportunities, and help produce doctors to serve the growing needs of Central Texas.
This was a new tax increase to fund a medical school. The taxpayers were funding that medical school. The flagship issue on the ballot was a medical school.
I'm Martha Smiley with the Greater Austin Chamber of Commerce. Many of the services that we've heard about this morning would be delivered by a new UT medical school. Prop 1 would make that possible at long last to build the medical school we've always wanted here in Austin.
I think that a lot of people got co-opted into supporting the initiative because they thought it was going to be good for poor people.
There are more than 200,000 people in Travis County without health insurance. Nearly 60.
There's liberal constituents in this city that I think would appreciate that. And they enlisted a lot of support in the community, and that's how it was sold.
Health care. I am here in full support of Proposition 1.
The sale was, number one, that this was going to benefit everybody. It was going to be based on equity, and so there was nothing to oppose. And so people basically embraced it. Most organizations bought it. They bought the whole thing hook, line, and sinker.
The time for medical school is now. Vote for Proposition 1.
And so it passed.
In 2012, voters approved a property tax increase to improve health care in Travis County, including support for a new medical school that aligned with the mission of Central Health to provide health care for low-income and uninsured residents.
At the time, I think people thought the money was going to be targeted to help the most vulnerable in our community. They didn't know that there was a real technical issue in passing a tax ratification that really went against state law and state constitution. That was not on anybody's radar.
It was set up very narrowly and it was focused. The state isn't really that big on social welfare, so it's constricted. You can spend the money for poor people. And that became important in my meeting with Senator Watson because he explained that it could only be spent on poor people, not for a medical school. We did meet with Senator Watson. He was preparing legislation that would have provided a cash contribution to a nonprofit. I said, well, if you're going to enlist the university, why don't you just give them the money? He said, you can't give them the money. One of the people that was in this meeting, he asked her not to take notes. I mean, I really couldn't understand what was going on. There is a contemporaneous written record because there were email exchanges where I kept asking, I don't understand how you can do this. When you change the statute, you still have a constitutional problem. I never got an answer. Senate Bill 821 did pass the Senate, and then when it went over to the House, it died in the House. So Senate Bill 821 never passed.
There is no way we will be able to do this using what I call the old playbook. The old playbook was something like a community would step up and say, we need a medical school. We need a 21st century teaching hospital. We need these sorts of research assets, those kinds of things. And the state would say, okay, well, we'll fund that. You made a good case, we're going to fund that for you. Well, if that ever existed, it doesn't exist anymore.
So if you're looking at the language of the ballot initiative, it was kind of ambiguous. And you know that 821 didn't pass, then you say somehow or another they set this thing up that it was going to be spent for poor people.
And to this day, everybody points back to the ballot and they say the voters approved this and this is what they wanted. But the voters didn't know where the details, right? And the devil is in the details. Right after passage of the tax ratification election, there was an agreement made between Central Health, Seton Hospital, and UT Medical School. And that agreement is called the affiliation agreement.
Next, I'd like to call on President Powers to present item 8 on page 41 concerning an agreement related to the Dell Medical School.
It is a request to approve the affiliation agreement with the Travis County Healthcare District, which we normally call Central Health, and the Community Care Collaborative that has Seton and Central Health and the Dell Medical Center.
Mr. Robert Ozer has asked to speak on this item. You have 3 minutes to address the board, and we look forward to your comments.
I have a little bit of a problem with this affiliation agreement. There are specific statutory and constitutional. The really key agreement in terms of the diversion of the money to the University of Texas, it took them forever to do that. I don't think they could figure out how to do it. They'd made all these representations that it was going to be spent for the poor, and they just gave the money to UT. They just, here's the $35 million. Now, there is a way to fix this, specifically put in the agreement that all of the funding that you get from Central Health is going to be used directly to fund health care for the indigent in Travis County. And then I would put in place documentation and a monitoring system that allows auditors to come in and look to see that the interests of the taxpayers are being implemented in terms of this agreement and that we're actually using the money for the purposes for which it was intended.
May I have a motion to approve this proposal?
I made the motion.
And a second? Second. All right. All in favor?
Aye.
Any opposed? All right, that carries. Item 9 on page 42 concerns a proposed contract with IBM.
That agreement, which is called the affiliation agreement, and now it's called services contract, was negotiated and drafted by Senator Watts' law firm.
We wouldn't be able to start the Dell Medical School without our partners. For example, with Seton and Central Health.
Senator Watts' law firm was the attorney working for Central Health, negotiating these agreements with Seton and the Dell Medical School. And last time I checked, the law firm had been paid over $4 million in fees.
Is that a conflict of interest?
The question was raised about a conflict of interest. It was not pursued by Central Health. The newspaper wrote an article suggesting there wasn't a conflict, and so it was never followed up on.
10 goals in 10 years is what we said back in September of 2011. We've seen a number of very important and extraordinary actions toward these goals. The public voted to increase their own taxes to help fund a transformation of the healthcare system through a partnership with the new medical school at the University of Texas, Seton, Central Health, Community Care, Austin Travis County Integral Care, and other providers and partners.
So right away, Central Health started transferring the $35 million, even though there was no services being provided during the construction phase. I was told that they were making use of that money. When we checked on that by public information request, that wasn't the case. They were basically reserving those monies and drawing interest.
What is the accounting system for the money? I have no idea. Do you know? No one knows. The money doesn't go directly from Central Health to UT. It goes into something called the Community Care Collaborative, or what I call a MATAG. It's like a washing machine. You can't track the money. So the money goes into some private entity. And then all of a sudden, boom, $35 million out to UT. Why have that level of complexity? Well, you know, you want to get them $35 million. Why don't you just give them $35 million? And when you give it to them, why don't you get an invoice that tells you how they're going to spend it? No, they send it to the MATAG, and then it twirls around and around and around, and then it goes out to UT.
On those expenses made to date, we have found that those expenses have indeed gone to salaries and recruitment costs and design costs and everything but the service delivery for indigent healthcare. Now, Dell Medical School is providing clinical services to the indigent for Central Health, but Central Health is paying for those services in addition to the $35 million.
After taking their money, they're billing them for what they've done.
Yes. So Central Health is not only providing $35 million to the Dell Medical School, but in addition to that, they are paying Dell Medical School for clinical services they provide through clinical fees that they pay to the Dell Medical School. There's 6 other hospital districts. They all have medical schools. The medical school provides a service, and the hospital district provides payment. There's a billing and there's a payment. There's units of care, units of service provided through the agreement. So it's not a blanket contract like Central Health has with the UT Medical School, which is $35 million to do these activities with any sort of invoicing. They do at the end of the year kind of a benefit report. It talks about some of the innovative things that they have been done, but there's not an invoice and there's not a payment.
You go into a doctor's office, they give you a bill. You're going to give them some money and you're going to get an invoice back and you've had a transaction. There's no damn accounting for the thing. You can't see where the money goes. And this is a governmental entity. How can you have that lack of visibility?
Dell Seton Medical Center is now open to patients.
Austin Travis County EMS moved more than 100 patients to the new facility, which will replace Brackenridge.
Up to 2004, the city was responsible for providing indigent health care through Brackenridge Hospital through Charity Care.
I've worked at a lot of hospitals in my career, and I would put the health care here at Brackenridge against anywhere else I've been in the country. There's research going on, there's teaching.
The Breckenridge Hospital is also the city's teaching hospital to train residents through Southwest Medicine in Galveston.
UT Southwestern brings about as much academic street cred as you could possibly have. They got more Nobel laureates than any other med school in the country.
The lease called for Seton to manage Breckenridge Hospital in a way that would continue to provide trauma care services. There's a charity hospital for Travis County for folks that were below 100% of the federal poverty level.
In 2012, Travis County voters approved a property tax increase to fix a broken healthcare system and create a new medical school. With a $35 million annual investment guaranteed by Central Health, the Dell Medical School at UT, Seton Healthcare Family, and Central Health are reinventing healthcare for Travis County residents.
The tax increase was about $60 to $7 million. 35 of that was going to UT. Seton was proposing to move their hospital over to the UT site, which meant they were going to stop paying their lease payment to Central Health, which is another $30 million. So essentially, the $60, $70 million increase from the tax rate was going to Seton and UT.
Central Health owned the hospital. They own the physical building, and they received rent for it. That's an enterprise. There's value to that enterprise. You get paid money to own it. You're a landlord. They didn't need the building anymore, and they gave it up. Did they receive compensation for that? Of course not. Nothing. They privatized the hospital and received no compensation from Seton for the enterprise value of a hospital that was earning $32, $34 million a year. Who gets shafted in that? Two people, the poor and the taxpayers.
Taxpayers in Travis County say their money is not going where it should. 3 residents have filed a lawsuit against Central Health. They say the hospital district is designed to provide health care to poor residents, but it's spending money on unrelated organizations instead.
I sent an open records request to the University of Texas over to Central Health, and I got back nobody had any records of how the money was spent. That's when I smelled a rat. I met with them 5 or 6 times. I made a proposal. Going forward, we want the $35 million a year to go for poor people's health care and a record trail to prove it. They never made a counteroffer. And as a lawyer, when you don't make a counteroffer, that means no, and so we sued them.
The people behind the lawsuit say they want Central Health to be held accountable.
Let us poor people know where can we really get help and people that's going to care for us.
This group wants a judge to order Central Health to spend taxpayer money only on indigent patient care.
I asked for the personnel records. I said, I want to see everybody's salary at the University of Texas Medical School that's paid for with Central Health dollars. And we got it back and found out that most of the dean's administrative staff, the communications department, the development department, researchers who did no medical care treatment, things that have nothing to do with the poor, were being paid for by Central Health dollars.
It's one thing to say how money can be spent, especially for poor people. It's another thing to enforce that. The folks with political power always decide where resources go.
Well, I think for the university, this is a legacy moment, a milestone.
So until you have a system that can ensure where these resources go based on a balance of power, what do? Other than have lawsuits or elect people that are honest, and good luck with that one.
Issues of ethics and how you comport yourself apply to both parties. People either do things the right way or they don't.
Who has the oversight of these institutions? They can break the law, but who's going to enforce the law? Unless they're sued and you have a pretty good legal team with money, there's no other alternative.
They say, it's not a governmental question, it's privatized. Go out and sue if you want. That's essentially what they said. Well, wait, I thought that the government was supposed to look at these kind of things. No. Bring your lawsuit.
We think of ourselves as a wealthy county. We are a very wealthy county, but not too hidden from sight is all the poverty, near poverty, and immiseration.
When Central Health was originally set up, it was set up to help those who needed the most help. Well, guess who the most needed is? It's in our neighborhood.
Central Texas Food Bank hosting a mobile food drive at Del Valley High School until noon.
Del Valley is made up of several neighborhoods in southeast Travis County that come together because of a school district. When you think of Del Valley as the school district, it's 174 square miles. It's huge.
People started lining up 3 hours before they even opened, and by the time it started at 9, about 400 cars filled the lot outside.
We have nothing that you would consider to be a service that would be needed in the 11th largest city in the country.
Del Valley is basically a desert with respect to the needs a normal community would have. When you talk about the things that are around people that they devalue, that's in our neighborhood.
The food bank prepared for 1,750 families to come today. Each family is receiving one 28-pound box of food and one hygiene box.
We do have a group of individuals that wouldn't be vocal about what they need. I think we have a group of individuals that don't know that they can be vocal about what they need. They absolutely have the right to. They've paid the taxes for it. I don't know that they know that they should want more.
Texas has a very weak safety net. We have not done Medicaid expansion. We have the highest rate of those without health insurance in the United States. There are 150,000 people that have no health insurance of any kind in Travis County. So the hospital district is crucial for plugging the holes for the poor's health care.
Central Health's poverty population continues to grow. We have poverty rates of over 30% in some areas.
There are a lot of people who need health care today who are not getting it because of the diversion of what is now $250 million to the University of Texas Medical School for things other than the poor.
The medical school offers a really innovative approach to healthcare. Healthcare is over 70% of the gross national product. The model is preventive care. It brings about breakthroughs in medicine. Who could be against that? Innovation in that form, everybody wants to support. But innovation isn't a holy grail if it's going to offset monies that should be intended to go to indigent healthcare.
$35 million a year can take care of a lot of people, especially low-income people who need it now.
It would support another 60,000, 70,000 people that could get health care immediately.
We need those resources still. We're not going to forget about it. We're going to make sure we get them. But that's easier said than done.
It's politically radioactive. You're essentially shooting peas out of a straw at this huge battleship.
There's a lot of fear. Once you put yourself out there, they can come after you, and Travis County has been known to do that.
You have to have people that will take this battle on, that will fight to publicize it, independent journalists to get the story out. I don't think people want to hurt poor people in this town.
I do see a backlash coming. We see some people who now are waking up now saying, wait a minute, this is not right, we have to change it. Once you raise political awareness, it's going to be a pretty interesting fight.